Let there be no doubt, the government is making mental health and well-being a key priority in our national agenda. We will increase capacity at the IMH and the redeveloped Alexandra Hospital for those that need specialist care. Capacity at long-term care facilities will also be increased to provide step-down care for those who need it. We will increase the number of public sector psychiatrists and psychologists by about 30% and 40% respectively. We will introduce mental health services to all polyclinics and 900 more GP clinics. We will equip and train an additional 28,000 frontline personnel and volunteers. They serve across our community and social service touchpoints so they can identify people struggling with mental health and offer early assistance.
Medical condition needs to be treated as an inpatient by a specialist. So, as has been discussed, there'll be 4 levels of mental health support, from mental health promotion, self-help, and peer support at Tier 1 to the most intensive level of care in hospitals and by specialists' clinics at Tier 4. And so, based on the severity of symptoms, individuals can tailor care according to their needs. Individuals with severe symptoms of mental health conditions will benefit from hospital-based psychiatric and medical treatment. Those with mild to moderate symptoms are best supported by mental health practitioners in primary care and community settings. And the majority of individuals who may experience mental distress periodically without a mental illness could be best supported by peer supporters in schools or workplaces, as well as using self-help resources for individuals with mental health needs. But we will also engage peer supporters and frontline personnel that are not within the healthcare and social space. They will be trained to identify mental health needs and provide psychological first aid if needed. And so the term is appropriate. Just as you don't need to be a healthcare worker to provide first aid, it's something that all of us can do. We want to train people to be able to provide psychological first aid, even if they're not a healthcare worker or a care professional. So today, over 48,000 frontline personnel, including school teachers, officers from agencies such as Singapore Police Force, Housing Development Board, Central Narcotics Bureau, social service officers, and family service centers, have been trained together with 54,000 volunteers to recognize and provide basic emotional support to individuals in need and to refer these individuals for further support as needed. The eventual goal is to extend this training approach to over 130,000 frontline personnel and volunteers by 2030.
Largest proportion of people with poor mental health in Singapore. Currently, we have community mental health teams known as CREST Youth and Youth Integrated Teams, or YITs, dedicated to support youths with mental health needs. CREST Youth reaches out to youths and parents to promote early identification of mental health symptoms and provide basic emotional support. YITs carry out mental health assessments and provide psychosocial interventions for youths who need more intensive support. The Response, Early Intervention and Assessment in Community Mental Health REACH teams work closely with schools to provide mental health assessments and interventions for students aged 6 to 19. CHAT, another mental health service which supports youths aged 16 to 30, has assessed over 7,000 youths at risk of developing mental health conditions as of September 2023. To support youths at risk of suicide or severe self-harm, an intermediate residential facility will also be developed. Not all youths who present with suicidal behavior suffer from mental health conditions. Instead, they may have experienced social stressors such as having difficulties coping with schoolwork and being bullied. We recognize the importance of youth's continued access to mental health services, and I appreciate Ms. Rachel Ong's earlier suggestion of having tiered guidelines for the requirement of parental consent on mental health services. In this regard, I would like to lay out several considerations that MOH is reviewing as we navigate this issue. These include balancing the need for youth's access to appropriate treatment, the involvement of the family and social support in youth's care journey, protection of the youth in view of the risks associated with treatments, and the level of maturity and understanding of the child.
On mental health and well-being at workplaces. We will continue to work with our tripartite partners, including NTUC and SNAF, to raise awareness of the importance of setting after-hours work communications policy while managing both employees and business needs. At the same time, the tripartite partners are pushing for greater adoption of work-life harmony measures, such as health and wellness programs and unrecorded time off for personal and family matters. Companies that find work week feasible, workable for their business and employees are free to do so. However, as with any work arrangement, this may only work well for certain sectors and jobs. I encourage employers to proactively discuss with employees the types of flexible work arrangements that suit both the business context and their employees' specific needs, including for caregivers, who might have special needs.
To do more to support our seniors with mental health needs. Currently, seniors are supported by the community outreach teams, CREST, to identify their mental health needs and provide basic emotional support and referrals to appropriate service providers. In addition, Active Aging Centres, AACs, work with CREST providers in serving as community nodes to conduct activities that engage and connect seniors within the community. We understand that some seniors may be reluctant to seek help or accept support for their mental health needs due to stigma. As part of their outreach efforts, Silver Generation ambassadors who come across these seniors would also share about mental health resources in the community and encourage them to seek help.